$1 billion. That's the number I want to start with today. A cool billion.
It's one of those numbers that almost doesn't feel real, you know?
Exactly. Feels like monopoly money. But for the state of Alabama, it's very, very real. It's taxpayer money, and it's all going to one private company to provide health care in its prisons.
And look, when you're talking about a contract that big, you expect it to go to, I mean, the most stable, most reputable company you can find, the gold standard.
A safe bet. You want a safe bet. But that's where this whole thing gets, well, strange. The company that won, YesCare, they're trying to have it both ways.
Mm-hmm.
In their marketing, they say they're a pioneer with 40 years of experience, but then in court, they argue they're a brand new company, like they were just born yesterday.
It's a total paradox. How can you be 40 years old and, less than a year old at the same time? And why would you even want to?
That is the big question. And that's what we're here for. Welcome to the Deep Dive.
Today, we're going to unpack this massive Alabama healthcare contract. We'll get into the corporate strategy they used, something called the Texas two-step.
We'll also look at some pretty serious allegations of undue influence in the bidding process, involving a lawyer who seems to be playing for both teams. And then we'll look at the real human cost of all this.
And just so you know, everything we're talking about today is pulled directly from the sources. We've got the ADOC contracts, bankruptcy court filings, some great investigative reporting from the Alabama Political Reporter and The Guardian, and state audits.
Okay, so let's start there. This identity crisis. Who or what is YesCare? Because their website says decades of experience, but their legal papers say they were incorporated in 2022.
Right, and it doesn't make sense until you look at the company they used to be, Corizon Health.
Oh, okay. That name I know. Corizon was a giant in this industry for a long time.
The biggest, the largest for-profit prison healthcare provider in the country. But being the biggest also made them a really big target.
A legal target, you mean?
A huge legal target. We're talking about an incredible amount of litigation for medical neglect. In just the 5 years before all this happened, Corizon was hit with over 1,300 lawsuits.
Wait, 1,300?
Yes.
In 5 years, that's almost one new lawsuit every single business day.
Exactly. And these weren't small claims. These were lawsuits alleging wrongful death, serious injury, sexual abuse by staff. The financial weight of all of that was, it was crushing them. They were losing contracts everywhere.
Okay, so a company drowning in debt and lawsuits, they file for bankruptcy. That's how it's supposed to work.
That's the normal path. But Corizon did something, well, much craftier. They used a legal strategy called the Texas two-step.
I've heard that term. It sounds like a dance move, not a way to handle corporate debt. How does it work?
It sounds harmless, right? But it's this loophole in Texas law. Basically, it lets you split your company in two.
Okay.
Imagine you just divide your household. Person A gets to keep the house, the car, the job, all the good stuff.
And person B?
Person B gets stuck with all the credit card debt and all the lawsuits.
Yeah. That can't be legal. You can't just hand off your debt to a clone and walk away.
In the corporate world, using this strategy, you can. So, Corizon split. Entity number one became YesCare. It got all the good stuff. The lucrative contracts, the employees, the assets.
And entity number two
became a company called Tessum Care Services. Tessum was handed all the debt and, critically, all 1,300 of those lawsuits.
So YesCare is the good twin, and Tessum is the evil twin designed to fail.
Yeah.
Let me guess what happened next.
You got it. Almost immediately, Tessum filed for Chapter 11 bankruptcy. And this is the key part. Filing for bankruptcy triggers something called an automatic stay.
Which is like a legal force field, right? It just stops everything.
It pauses all litigation instantly. So if you were a family suing over a death in a Corizon facility, your lawsuit just hit a brick wall. You can't sue YesCare because they say, hey, we're a new company.
Even though it's the same staff, same leadership, same everything.
Correct. And you can't get money from Tehum because they're bankrupt. It leaves all those victims in total legal limbo.
Wow. It's a get-out-of-jail-free card for corporate liability.
That's what critics call it. And the irony is just, it's staggering. In the courtroom, the lawyers say, we are not Corizon. But to the state of Alabama, the sales team is saying, hire us, we've got 40 years of Corizon's experience.
Which brings us right back to Alabama. And that $1 billion. Despite all this public mess, the Alabama Department of Corrections, or ADOC, gives this brand new controversy-plagued company a $1.06 billion contract.
It's the largest contract in the department's history. And you'd think, for that kind of money, the process would have to be squeaky clean.
But the reporting suggests it was anything but.
Messy is a very polite word for it. First off, YesCare wasn't even the lowest bidder.
Wait, what? I thought government contracts almost always go to the lowest bidder to save taxpayer money.
Usually. But
Yeah.
the state said YesCare offered the best overall value, which is a subjective term, but it gets much, much worse. There was an inside information scandal.
Right. ADOC had to stop the whole bidding process at one point.
Yes, because they admitted that one of the vendors, everyone presumes it was YesCare, got information that the other bidders didn't. Someone basically gave them the answers to the test.
So they had to restart the whole thing.
They did, and guess who won anyway?
Yes, Care. Really feels like the fix was in. And then there's this name that keeps popping up. Bill Lunsford. Who is this guy?
Bill Lunsford is a private lawyer, but he is very, very connected. He's made millions, over $20 million, from state contracts defending ADOC against lawsuits over its terrible prison conditions.
So he's the state's top defense attorney for the prison system.
He is. And just a few weeks before this billion-dollar contract was announced, Lunsford was appointed to YesCare's board of advisors.
Hold on. The guy the state pays millions to defend the prisons is suddenly on the advisory board of the company trying to win a billion-dollar contract from those same prisons.
That's the timeline. That's the conflict of interest that had legislators screaming it looks like a classic revolving door.
Or a kickback. I mean, it raises the question of whose interests he was really serving, right? The states or the companies.
Exactly. Representative Chris England put it best. He called it a marriage between a desperate state and a desperate company.
What did he mean by that?
Well, Alabama is desperate. Its prison system is an absolute disaster. It's facing a huge DOJ lawsuit. They just need someone, anyone, to handle health care to make the problem go away.
And the company's desperate.
Because after the whole Texas two-step, they needed a huge contract to prove they were still a viable business. England basically asked, are we just pouring $1 billion into a sinking ship?
It paints a really grim picture of powerful people making deals, and you have to wonder if the actual healthcare part even matters to them.
Which is the perfect pivot, because at the end of the day, this is about medical care. YesCare has this whole pitch for something they call the recovery model.
It sounds good on paper. It's all about holistic care, preventing suicide, using data. Very modern.
It sounds great in a marketing brochure, but then you look at the reality. There was a state audit in Maryland, where YesCare also operates. The results were pretty damning.
How so?
The Maryland controller literally called the company uniquely terrible.
Uniquely terrible.
Yeah.
You don't forget a quote like that from a state official.
No, you don't. And the audit had the numbers to back it up. In just one 3-month period, the company failed to complete 548 suicide risk evaluations.
548 in 3 months.
Mm-hmm.
That's not a mistake. That's a pattern. That's a complete systemic failure.
It is, and it gets to the core of the problem, which is the business model itself. Most of these contracts use what's called a capitated model.
Okay, break that down for us. Capitated.
It means the state pays the company a flat fee per inmate per day. Let's just say it's $20 a day for every single person. That $20 has to cover everything. Aspirin, chemo, ER visits, everything.
I see the problem already. If you spend $5 on care, you keep 15 as profit.
Exactly. But if an inmate gets really sick and needs, say, a hospital stay that costs thousands of dollars, that money comes directly out of your profit.
So the financial incentive isn't to provide care. It's to deny care.
The incentive is to do the absolute bare minimum. The less you spend, the more you make. It creates this constant perverse battle between a patient's health and a company's bottom line.
And that's why you see stories like the one out of Bernalillo County, New Mexico. They kicked YesCare out, right?
They did. They canceled the contract early, which almost never happens. They cited staffing shortages and a horrifying spike in deaths. 21 inmates died in just 2 years. When you cut corners to protect profit, people die.
And we have to talk about what this looks like for a real person, for a family. Because the numbers are one thing, but the story of Brian Rigsby, that's what shows you the true cost.
Brian Rigsby's story is it's heartbreaking. He was an inmate at Staten Prison in Alabama, 46 years old.
And he got very sick.
Terminally ill. He was hospitalized with liver failure. He and his family decided to stop life-saving measures and just move to palliative care. His mom, who was a hospice nurse, was trying to get him a medical furlough so he could die at home.
Compassionate release. Let him die with some dignity.
Exactly. But while the paperwork was being processed, YesCare staff reportedly called the hospital. They said they were going to stop paying for his hospital bed.
Wait, because he was only getting comfort care, not active treatment, they decided to cut him off.
It looks like it was purely a billing decision. It was costing them money to keep him there, so they had him transferred back to the prison infirmary.
Oh my God.
So you have this dying man taken from a hospital, put back in shackles, and moved back behind prison walls.
And the worst part was what it did to his family.
It cut them off completely. In the hospital, his mom could visit, hold his hand. The minute he was back in prison, that was it. She was never allowed to see or even speak to him again.
She said she would call, and they wouldn't even take the phone to his bed so she could say goodbye.
He died a week later, alone in the prison infirmary. And when you trace it all back, it comes down to that financial incentive. Keeping him in the hospital cost money. Moving him back to the prison saved money. End of story.
And there's no accountability because of the Texas two-step. The legal walls are already built.
Right. It's a system designed to protect the company, not the patient.
Now, to be fair, the bankruptcy court did approve a settlement for the old Corizon victims.
It did, about $75 million. But when you divide that among thousands of victims and creditors,
It's pennies on the dollar. It's not justice.
it's an insult.
So let's just recap. You have a company that uses a legal loophole to ditch 1,300 lawsuits.
The Texas two-step.
That new company then uses its insider connections to win a billion-dollar contract in Alabama, even after an information leaking scandal. And the care they provide is built on a model that financially incentivizes denying treatment, which leads to, well, to stories like Brian Rigsby's.
It's a cycle. Restructure, rebrand, repeat the same behavior. And the scary part is, it's a blueprint. If it works for them, other companies are going to start doing it too.
You start to see how the state itself is complicit. They're just outsourcing a constitutional duty to care for people, and then they get to wash their hands of it.
The state gets to solve a political problem, the company gets to make a profit, and the inmate is the one who pays the price.
It all comes back to incentives.
Yeah.
Can you really have quality care when the provider makes more money by not providing it?
And can you have accountability when that same provider can just legally change its name to escape its past?
We started this with $1 billion, and we ended with a man dying alone, unable to speak to his mother. The story is what happens in the space between that huge sum of money and that one human being.
And as long as these loopholes exist, that space is just going to be filled with more tragedy.
So here's the thought we want to leave you with. We always hear that privatization is more efficient, that private companies do things better and cheaper. But when you look at this whole story, the legal games, the shed liability, the human cost, you have to ask, is this actually efficiency? Or is the efficiency of privatization just the efficiency of evading accountability?
If you can legally separate your profits from your mistakes, what possible incentive is there to ever get better?
Something to think about. Thanks for joining us on this deep dive.
Thank you.
We'll see you next time. Stay curious.